If you're in the Philippines and you're trying to figure out health coverage, you've almost definitely run into MediCard. But let's be honest, figuring out their HMO plans can feel, well, a little overwhelming. So today, we're going to decode it all for you. We're breaking down the actual contracts so you can make a really clear choice for yourself or your family.
Yep, that's right. We have literally waded through all 50-plus pages of the fine print, all that dense legal jargon, to pull out exactly what you need to know. What's the goal here? To save you a ton of time and hopefully a whole lot of headaches down the road.
So, where do you even start? You've decided you want coverage, but what's the first move? Well, the good news is, the process itself is actually pretty straightforward. Let's walk through it together.
And getting your membership started really just boils down to these 4 simple things. You need to fill out the application form completely, have one valid ID ready, sign the agreement, that's the MOA, and of course, provide your proof of payment. It's just a simple checklist to get you on your way to being covered.
Okay, this is probably one of the biggest questions people have. You want to protect your loved ones, right? But who exactly qualifies for coverage under your plan? The rules here are very, very specific.
Now, you'll want to pay really close attention to that last point, the hierarchy rule. This is a critical detail, folks. It's not just about who you can enroll, but the order you have to enroll them in. If you're married, your spouse has to be your first dependent before you can add your kids. And if you're single, your parents come before your siblings. This means a married person can't just skip their spouse to enroll their own parents instead. It's a crucial rule you absolutely have to remember.
Alright, so once you've got a handle on who you're enrolling, you're going to face your first big decision, choosing between the standard and the VIP program. This choice is really going to shape your coverage, and of course, what it's going to cost you.
The easiest way to think about it is like this. The standard plan is your essential, no-frills, super budget-friendly option. It's designed to be the most affordable plan out there that just covers the core necessities. The VIP plan, on the other hand, well, that's the premium package. It definitely comes with a higher price tag, but it also packs in a lot more benefits, higher coverage limits, and even some pretty interesting lifestyle perks.
So what do you really get for that extra money? The VIP plan has some pretty key advantages. If you have an emergency and end up in a non-accredited hospital, you get 100% reimbursement versus just 80% on the standard plan. You also get something called a point of service program, which lets you get reimbursed for seeing doctors who aren't even in the MediCard network. Plus, you get things like those comprehensive executive checkups, reimbursement for outpatient medicines, and yeah, even lifestyle perks like skin treatments and yoga classes.
Now, whether you go standard or VIP, both plans are built on the same foundation of core health benefits. So let's take a look at the main pillars of coverage that you can expect no matter which path you end up taking.
So every single plan is built on these 5 key areas. You've got preventative care, like your annual physical exam. You have outpatient services for doctor consultations and lab tests. There's inpatient coverage for when you're confined to a hospital. And on top of that, you have emergency and basic dental care. This is basically the foundational package of protection that you're buying into.
Okay, now for what might be the most important section of this whole explainer. Every insurance contract has fine print, right? And this is where people often get surprised. Understanding what is not covered is every bit as important as knowing what is. So we're going to break down those gotchas for you.
First up, the big one, pre-existing conditions, or PECs. In simple terms, this is any health issue that you already had or that had already started showing signs before your MediCard plan kicked in. And it's really important to know that it's MediCard's own doctors who make the final call on what actually counts as pre-existing.
This timeline shows just how critical the timing is. For your entire first year of membership, 0 coverage for pre-existing conditions. None. Coverage only starts to kick in on your second year, and even then, it's pretty limited. A standard plan, for example, might only cover up to 5,000 pesos per illness per year. This waiting period is an absolutely vital piece of the puzzle to understand.
It's also so important to know the major exclusions that apply to most plans. A huge one is that maternity care is not covered on standard plans. Other really common exclusions are things like psychiatric conditions, cosmetic procedures, any hereditary defects, a lot of autoimmune diseases like Parkinson's, and corrective eye surgery. Just knowing these up front can help manage your expectations and prevent some really tough surprises later on.
All right, let's get to the question on everyone's mind. How much does all this actually cost? We're going to look at some sample annual premiums pulled directly from the official rate sheets to give you a really clear idea of the investment you'd be making.
So here's a look at the standard plan. For a single person who's okay with a wardroom, the annual premium is just a little over 10,000 pesos. Now, if you upgrade to a semi-private room and add one dependent, you're looking at about 22,600 pesos for the whole year. This really shows you just how affordable those entry-level plans can be.
Now let's immediately compare that to the VIP plan. You can see the jump in price, but that reflects the jump in benefits we talked about. A single person in a regular private room starts at over 25,000 pesos a year. And if you go for a large private room with one dependent, that premium goes up to over 82,000 pesos. Seeing these numbers side by side really clarifies the budget difference between the two tiers.
One final but really important note on cost. HMO plans are designed to work with PhilHealth. So if you are not an active PhilHealth member, you'll have to pay an extra fee. It's around 2,700 pesos, so that MediCard can cover the part of your hospital bills that PhilHealth normally would.
So what's the bottom line here? It all comes down to understanding the rules before you actually need the coverage. Rules just like the one on the screen, that dependent hierarchy, are totally non-negotiable. The same goes for that one-year waiting period for pre-existing conditions and that list of things that just aren't covered. Reviewing these details carefully is probably the single best thing you can do before you sign on that dotted line.
So, we've laid it all out. The requirements, the big choices, what's covered, what's not, and the costs. The final question really is for you. Based on your own health situation, your family's needs, and what you're willing to invest for that peace of mind, which path is the right one for you? Hopefully, after all this, that decision is just a little bit clearer.